Pregnancy provides an excellent opportunity for treatment of women with opioid use disorder. Universal screening is part of comprehensive prenatal care. Early screening, brief intervention, and referral for treatment, known as SBIRT, is a simple conversation with the patient, providing feedback and advice. I'm going to ask you some routine questions we ask of all our patients. And the topic touches on alcohol and drug use. Is that okay to discuss?
Yes.
When you think back about your parents, do they have any issues with drug use or alcohol, or can you recall anything?
I used to see them drinking from time to time growing up, but I never heard anyone say there was a problem.
Okay. Now, with your friends, do any of your friends have any issues with alcohol or drug use, or do you recall anything?
We like to have a few drinks and party on occasion.
Okay. So we'll go to thinking about your partner. As far as your partner, do they have any issues with drug or alcohol?
He would come out with me and my friends when we party, but I don't think there's a problem.
Okay. And in your past, before you were pregnant, did you have any issues with drugs or alcohol, or did your friends ever tell you, hey, you have a problem, you should look into this?
I used to drink on occasion, but I can't think of a time where there have been difficulties from drinking. I haven't had alcohol since finding out I was pregnant. I was prescribed oxycodone about a year ago now for back pain, and I'm still on a low amount, but my prescription use feels really normal to me. I only take it when I have pain, but I just don't know how it would affect the baby.
Okay, very good on stopping the alcohol use. And with respect to the medication, what we'll do is we'll talk about that, the opioids, later on, and we'll just finish some questions now. I know you just said that you stopped drinking when pregnancy started, but I want to just ask you, since pregnancy started, have you had any issues with drugs, even prescription drugs?
No, I haven't been taking anything else.
Okay. So I'm going to change the topic a little bit here and just ask, do you use tobacco? Have you used cigarettes, including vaping or marijuana, anything like that?
No, I haven't been.
Okay. With respect to your mood and, say, depression, do you have any problems, or have you had any problems with depression? Do you feel like you're maybe over-anxious at times, or worried about things, or not able to get things done at home?
No, I can't think of a time.
Okay. And at home, do you feel safe? Do you feel that you're okay, you're not going to be threatened or hurt? Is anyone trying to control you?
No, definitely not.
Okay, now we got through those questions. I just want to start to talk a little bit about the medication itself, the oxycodone, and try and answer the questions that you came here for. So how often are you taking the medication?
I take it any day that my back is acting up.
And do you think you're getting relief when you take the medication?
Yeah, I think so.
Okay. Do you know what the dose of the medication is that you're taking?
It might be 5 milligrams or 10 milligrams. I'm not sure. I forgot.
That's okay. There's a mechanism which I can look up the dosage using a state system, so that won't be a problem. Have you ever tried to stop the medication?
I haven't tried that.
Okay. And did you let your provider know that's prescribing the medication that you were pregnant?
I scheduled this appointment first.
Okay, so let me just explain a little bit about the medication and the options. So the medication you're taking is for pain, and you could possibly stay on that medication if it's managing your pain well, or you could possibly reduce the medication through pregnancy, but it has to be a very slow reduction. So those are really the two options. We'll have to be in touch with your provider that's prescribing the medication to sort of make a plan. So that's for you to think about as the weeks go by. With respect to the baby, if you're staying on the medication, so when you deliver, in the first week after you deliver, the baby will be observed. And the baby's observed because it's an adjustment period for the baby. It's something called neonatal abstinence syndrome, or NAS. So they watch the baby because the baby doesn't have any more oxycodone coming from you, and so the baby just needs to be observed to make sure that there's no issues. And we can certainly discuss that as pregnancy progresses, depending on what plan you decide. Do you have any other questions you want to ask?
Is there anything that I can read up more information?
Sure. Actually, I was going to give this to you before you left. This is some information about opioid use in pregnancy and includes information about neonatal abstinence syndrome. Is there anything else?
No, thank you. This is really helpful.
Well, congratulations on your pregnancy. I'm really happy for you. And I look forward to seeing you again.
Thank you. Likewise.
Thank you very much.
The next step in the management of this patient will be contacting the prescribing provider about the opioids and taking a team approach to whether she's continuing the medication or not. And if she is continuing the medication, further education about neonatal abstinence syndrome, as well as a pediatric consultation. We'll also continue routine prenatal care.